Hi, I'm Dr. Castanet. I'm going to explain to you about neck and back pain. Neck and back pain, over 98% of the time, is as a result of the common, progressive, slow, degenerative process of discs and subsequent sequelae of that process. So that what happens is, as we're children and as we grow through adolescence and then young adulthood and become older, we start to acquire small, microscopic, degenerative changes to the discs. You may know that the discs are the connective tissue components that are between each of the vertebrae. So the spine is made up of, let's say, 26 different segments, including 7 bones in the neck, 12 in the middle back, 5 in the low back typically, and then you have the sacrum and the coccyx at the bottom. Between most of those, from C3 down through S1, we have discs. The discs have several purposes, but one of them is that they are a cushion between the vertebrae. And throughout the degenerative process, especially in the more mobile regions of the spine, such as the neck and the low back, where many more physical demands take place during the course of our lifetimes, those discs tend to wear out. What happens is they acquire little tears that happen in the central part of the disc. Those tears work their way out to the periphery of the disc. In this sense, envision the disc a little like a jelly donut, except that the donut part is, let's say, treads of a tire. Several different layers. The layers are oriented, and let's say there are probably 12 to 25 layers. The fibers of one layer are oriented like this, the next layer will be oriented like this, and so on. So it's almost like a woven basket. Not so much interwoven like this, but alternately with oblique fibers in one direction and then oblique fibers in the next, and so on. So this very tough design of fibrous tissue encloses a consistency of disc that is more watery in the center, a little less tough. In fact, surgeons will liken it to crab meat in consistency. It's not quite the really tough fibrous treads of the outer part of the disc, but the inner part imbibes water and kind of like a sponge, but so it's not quite the thick fibrous consistency, but it's more absorbing of water. And when we lay down at night, it absorbs water, and then when we're upright, as compressive forces load each of the discs between the bones, that compressive and water force then pushes out against the walls of the disc and distributes the loads to the outer walls of the disc. The problem is that while it's a great design, it's not infallible. And the status of the disc is a function of the daily degenerative and regenerative influences. So for example, when you are doing lifting, bending, sitting, carrying, driving, wrestling, football, basketball, gymnastics, sitting, you name it, driving, all these things, they place physical loads on the disc that tend to have a degenerative influence. On the other hand, when we rest at night, and this you could say is true of all bodily systems, when we rest at night, we unload the physical demands from the disc. That's a chance for it to imbibe water, imbibe nutrition, oxygen, all those sorts of things, so that has a regenerative influence. And how we do in the course of our lifetimes in the way of back and neck pain is a function or a product of the net influence of these different factors. So what we want to do in the way of regeneration is rest, sleep 7-8 hours or better, 9 hours. That's probably appropriate. We want a good nutritional status, which is almost never the case, certainly not the case in a standard American diet. If you don't make great pains to eat healthily, then you're not providing your disc the substrates to regenerate the disc. So that's an influence, and that's an influence very seldom cited by doctors, and I think it's a very, very important influence. So anyway, during the course of the day, we indulge in all these physical demands, place all these demands on the disc. At night, we may or may not, given all the variables that have a regenerative influence, suffice to undo the degenerative influences. So typically, for each of us, at one or perhaps more levels of discs, we may incur net degenerative processes. Some people degenerate very little over the course of the lifetime. I've had patients that have several discs that look like they're young discs, and these patients may be in their 80s. Who knows why? There are theoretical and real factors we can cite. For example, the 4 factors we know are related to back pain and degenerative disc disease are males, smokers, drivers, and material handlers. Those 4 variables we know have an influence on the disc. There are other theoretical influences we could cite, like sports, nutritional status, and a number of others. So anyway, these influences in some people will degenerate a disc very quickly. There are some people we look at in their 30s and they have severe disc collapse. When that happens, it puts more stress on the bones. The bones then become swollen. We see those on MRI scans. We call those modic changes. When the bones become swollen, over time they will also become deformed because of the pressure on the bones. Bones respond by deforming and adapting to these physical loads. When we see those bony deformities, we call that arthritis or degenerative changes. I don't like to use the term arthritis because I think it incites more fear in people. Degenerative changes are sort of implicitly understood to be sort of normal, more or less, and it depends again on how severe those degenerative changes are. For many people, degenerative changes are mild and what we term age appropriate. So if the patient has degenerative changes we anticipate in a person their age, we say they're age appropriate. If they're better than we expect, then that's great. There are occasions when I see patients and we do imaging, whether it's X-ray or MRI scan, and their imaging looks very good and we're not entirely certain why they're having their pain, but there's nothing obvious on imaging that tells us about the cause of the pain. There are other occasions, many occasions, when we'll look at imaging, and this is probably the case most of the time. Let's say 85-90% of the time we'll do imaging, X-ray or MRI scan, and we'll see a lesion or something on the imaging that we think correlates or probably explains the cause of the patient's pain. The nature of these lesions is always compressive. People always get compressed as a result of these lesions, whether it's a disc bulge, a disc herniation, disc collapse, loss of water content in the disc. Discs always are collapsed and compressed when we see a lesion. There are a very tiny subset of patients that have other causes of back pain, but that's less than 2% of the time. That would be for things like cancer, fracture dislocations, tumors, infections, things like that. And then there's also a small subset of patients that have what we term instabilities, where the vertebrae slip or slide on each other, and those may have to be fixed surgically. A mild instability can sometimes be treated non-surgically, but I don't want to get off into these infrequent, rare, or uncommon occurrences of back and neck pain. More than 98% of the reason or time that we get neck and back pain, it's from the simple process of degenerative changes to the disc that over time will give rise to degenerative changes in the adjacent bones above and below. These disc changes may happen at only one disc in a person, or they may happen at 2, 3, 4, or all the disc levels. Some people have single lesions, some people have multiple lesions. We don't know why. We think genetics plays some part in that. In fact, genetics probably plays a significant role in terms of the general degenerative process of people. But epigenetic, meaning environmental factors, probably play a role that is underappreciated, because the normal status of the American populace is one of nutritional deficiency, horrible diets, providing inefficient number of substrates, so that over time we become progressively degenerated and progressively deficient in the quality of our diet and health status. In any case, let me get back to the degenerative process. Compression and degeneration are the cause of more than 98% of neck and back pain. What is the most appropriate, direct, and effective redress for this process? It's very simple. I've been in treating back and neck problems for next year, which is almost here now, will be 29 years. I spent 18 years in orthopedics, physical medicine, and physical therapy. I've been a chiropractor all of these years. I spent 4 years part-time in a neurosurgical practice learning surgical indications and procedures. I see different and common themes in all these fields, and I have vetted many different treatments, non-surgical, and I've seen the surgical treatments as well, and I've seen pain management. So I'm quite familiar with all of these means of treatment, and I can tell you that the last 9 years, 10 years, this year actually, 10 years, I have been using spinal decompression treatment. This is a treatment, a non-surgical treatment, that reverses these compressive changes and reverses the cause of neck and back pain. It's very simple. It pulls the discs apart. It gets pressure off of the 3 common pain generators in the neck and the back, meaning the disc, the joints, and the nerves. All of those are the common pain generators in the spine, with very rare exception, and those all benefit from decompressing them physically and anatomically. Hi, I'm Dr. Castanet. I've done previous videos where I explain what causes neck and back pain. It's a unique explanation. It's the most logical and simplest explanation, and my explanation is compelling. I'm going to show you, however, some imaging now, diagnostic imaging, because I think that'll help provide some more background for my ideas about this. My ideas are not unusual. If you look at any textbook on the pathophysiology of spines and degeneration of spines and all of those related topics, you'll see for yourself. And if you look at imaging, I mean, it's implicit in the diagnostic imaging we do and the way we evaluate diagnostic imaging and what we do in response to what we see. It is implicit that we understand, all doctors and providers that look at these things and manage patients, that we are treating a degenerative process. That's largely what it is, like anything else in the body. Most of the problems we treat are not traumatic in nature, whether it's any of the 11 body systems. Most problems we deal with are chronic and degenerative and progressive in nature. So understanding that process is important to addressing it appropriately. So I'm going to show you some imaging, X-rays and MRI scans, and you will get the idea by looking at some imaging that what I say is really the only logical argument for the nature of back and neck pain more than 98% of the time. You have lots of practitioners that talk about core strengthening and impute the piriformis muscle and the sacroiliac joint and all sorts of different tissues as the cause of common pain complaints. That's all nonsense, and they're all chasing their tails. Those things can happen as an infrequent cause, but the frequent, boring, common cause of neck and back pain is the simple degenerative process of the disc and spine over time. It's a compressive phenomenon. Decompressing the spine is the most appropriate, direct, and effective redress for this process, and you will know it intuitively and logically when I show you some imaging that we look at that depicts the degenerative process to varying degrees in different people at varying rates. So let's look at some of that now. Okay, this is Dr. Castanet again. I'm going to now familiarize you with some MRI imaging of the neck and low back. I want to give you a taste for what the degenerative compressive process looks like on diagnostic imaging so that you understand how logical and intuitive this approach and conception of back and neck problems is, and the approach to treatment, how rational it is, and why it's more effective than other treatments. More effective than other treatments. The reason is that it partially regenerates these tissues. If you make no effort to regenerate these tissues, you condemn the person to the natural history of the disease, which is very, very nasty for some people. Some people have severe neck and back pain, severe degeneration, and they will have a miserable quality of life if you don't intervene in the process in this very specific direct approach to treatment. So, what I have here is a lumbar MRI scan over here. I'm going to come a little bit wider. If you look at this MRI scan, you see a vertebra here, there, and there. Back here, we have the canal where the nerve roots descend. It's white in color. At the very bottom here, you have the top of the sacrum. We call this sacrum, this segment, the S1 segment, because the sacrum is made up of 5 segments, and we, by convention, call the first one at the top S1, S2, and so on as we descend. If you look at this disc, you can see it looks different than the others. And I don't know how well this is being depicted on this, but these discs here and here and here and there and above all have a fairly kind of a grayish color. Down at the very bottom, it's darker in color. Why? Well, it's lost water content. It is degenerating. It's lost a little bit of height. In fact, you can also see a disc bulge or herniation at the bottom here, sticking out into the canal. And to the extent that any of the disc contents migrate out or herniate out, that means there's less volume here and there's a commensurate collapse of this disc. And that's what you see in this particular shot. This person had low back pain. This was the source of the low back pain. If you pull these vertebrae apart to get pressure off of this, it can reduce the size of the disc herniation. It also takes pressure off of the fibers there that are innervated and are a source of pain. It also gets pressure off of the joints, the bony joints back here, that bear more weight when the disc collapses and the vertebrae approximate and then have more weight borne by the joints. The joints are not intended and designed to bear a lot of weight, so they can become a source of pain. Okay, so now I'm going to go back to a cervical MRI scan. You're getting familiar with the anatomy, I'm sure. Let's see. These are the vertebrae right there, there. That's the second cervical vertebra. There's the spinal cord, this gray stripe. This is something that does not exist in the lowermost back because the spinal cord ends at L1. So this is an entity we have to be thinking about clinically in the way of neck lesions, but not in the low back, at least not below L1. Anyway, there's a vertebra, that's C2. There are 7 cervical vertebrae, that's C3, 4, 5, 6, 7, and that's T1, the first thoracic, top of the low back. If you look at the disc borders back here, there's the disc border there, looks reasonably good. This one is sticking out a bit in this particular slice. This one's sticking out a little bit. And the height of these two, I would say, is less than it ought to be. This one sticking out a tiny bit, this one significantly more. This is the C3-4 disc. Typically, the ones that degenerate the fastest are C5-6 and C6-7. The C3-4 is a little unusual. And this is C2-3 sticking out considerably. Also notice that it's contacting the cord in this slice and up here. I'm going to go through different slices. This slice, this looks a little worse. That looks a little bit like a problem. That one as well, and that one, and not so much in that slice there for C2-3. I'm going to scroll through different slices. I see a little bit of disc issue here and here associated with some bony changes. The bones at this point look reasonably good. They're not, there's no significant deformity of the bones, but I can see that that's going to be the case at some point because this disc has definitely lost height relative to this one. This one has also lost some disc height. This one I think as well, and this one a little bit as well. Let's go through more of these. That disc lesion looks worse there. In any case, you get the idea. In this case, we have some disc compression here and here and here and here, and even up here in this slice. We have a little bit of compression going on at the cord, there and there particularly. Also, as often happens when the discs degenerate, the curve, the normal curve in the neck is lost. The neck's supposed to have a curve that functions as a spring so that as you bear weight and you walk with each step, there's kind of a springiness to the neck itself. You don't want a feature in the neck like this where the neck is straight as a result of degenerative changes. Then with each step, it's almost like it's being rammed straight down and there isn't the normal kind of springiness to the neck. So that exacerbates the degenerative process. In any case, once again, I'll sound like a broken record, but decompressing these levels is the most effective direct redress for this problem. It's the smartest way to treat this problem. Spines would last longer if we did this as a means of treatment whenever people have back problems and neck problems. It's irrational and it's stupid the way people are treated non-surgically for neck and back problems. There are other appropriate adjunctive treatments such as strengthening the neck, exercises, range of motion, that sort of thing, but they don't directly address what is obviously the problem, this anatomical, degenerative, progressive compression of the neck. I'm going to go over here to a little different image. This is the same person's neck in what we term a T1 weighted image that results in a little different contrast of the images. Sometimes it tells us a little bit more. For our purposes, I don't think this is any more helpful than just the previous T2 weighted images. So that's enough of that. I think you get the idea now that compression is the nature of the beast when it comes to the source of and cause of neck and back pain. Decompressing the neck and back is the most effective treatment. I've been doing treating patients for 28 years. It was very frustrating for a long time because people with a significant disc lesion did not improve. We sent them for injections. Sometimes that helped, sometimes it didn't. Injections help the inflammatory consequence of the compression. They do not improve the anatomy of the spine. They do not improve the natural history of a person's neck or back. Treating these neck and back problems, as I suggest, is the smartest, most logical, and most effective means of pre- or non-surgical treatment. So that's it. Thank you. Okay, this is another example of a lumbar MRI scan. Very clearly you can see this is white in color, a lot of water content there and there. So these discs are nice and hydrated and not degenerated. This one, by contrast, is darker in color. It's lost water content. and you can see the disc herniation back there. Again, the theme is compression. This disc is herniated. It will put pressure on the nerves as they come down here, pinch the nerve and cause pain. This is a painful disc. Open it up, get more water in there, reduce the size of the herniation, and feel better. If you fail to do that, you're not directly treating the cause of the pain, and it's a foolish approach to treatment. You've got to decompress that disc for the person to feel better and make that spine and that disc last as long as possible. Here is an excellent example of a lumbar MRI scan with terrible compressive changes. This is the top of the sacrum there. That disc at the lowermost level is the L5S1 disc. It looks reasonably good. There's probably a little bulge right there. This level here, you can see this disc is collapsed. There are associated white coloration of the vertebrae, indicates swelling of the vertebrae. There's collapse of that disc, a little bit of disc content sticking out there. It's a small herniation. A large herniation there with associated spurs of the bones or vertebrae there. This disc is reasonably good with good disc height. This disc, again, you see collapse of the disc with the disc herniation there and some spurs there. You see some rough appearance to what we call the vertebral end plates there. Erosion of the vertebrae, the normal shape. The normal shape should be a nice smooth curve. Instead, you see a kind of erosion or moth-eaten appearance of the vertebral end plates because of the degenerative process. So again, same old theme, compression and destruction of that disc and this one as well down here. This is going to be a source of back pain. That's going to be a source of back pain. The disc bulge or herniation at that level and this level may pinch a nerve root. It's a nasty looking spine, and unfortunately these people typically have pain. They can usually improve, however, with spinal decompression. That is the most effective way to treat this problem. You've got to make this person's spine last as long as possible. Surgical treatment, if and when it becomes necessary at some point, will involve spacing this again, jacking it up, putting a spacer in there, fusing these two vertebrae together, but in a better position with less compression. Perhaps the same at that level, though they'll try to avoid that as much as possible because you can't typically fuse one level and a non-adjacent level without also involving that level, and this level looks fine right now. So hopefully, if this person's back pain didn't respond enough to non-surgical decompression, then you would surgically decompress this level and hopefully not have to do this. Unfortunately, if and when this became an issue that needed surgical treatment, this would have to be involved as well, and then you'd have a 3-level fusion. You don't really want that if at all possible. Spinal decompression should be done as soon as possible to get this level better and this level better and make this person spine last as long as possible, hopefully for the remainder of his lifetime. So again, the same old theme, compression is the cause of pain, decompression is the appropriate treatment. Usually it can be done without surgery, but that's the appropriate approach for most effective treatment. Exercises aren't going to do anything for that. Adjustments are not going to do anything for that. Physical therapy is not going to do anything for that. Core strengthening will not do anything for that. Decompress this level to get better and feel better.